properties. It broadened the scope in tissue engineering and wound dressing. So this is the conclusion from my side. This is the publications. This is a biomaterial journal. I think this is rank 1 in biomaterials. See, so this, since it is a new work, our paper got published in this particular journal. This is another paper in this particular covering this aspect only. So whole this work, it is basically published. So this is all basically about the wound dressing materials. This is the very recent work we are doing, and I thought it's good to share with the new brains, our young brains. This is the dressings we want to prepare, which not only control the infection, but it also diagnose the infection. So this is only 2-3 slides of my recent work, where basically what we are doing is we are using a pH responsive probe in this dressing, which can actually tell us that if there is an infection, the dressings will change the color, and it shows that the wound is actually now getting infected. Now, what is the hypothesis behind it is, when we have a healthy wound, the pH of the wound is less than 6.5. When we have an infected wound or an unhealthy wound, the pH of the wound, it increases to alkaline side, means 9, 11, like that way. You can see here, this is the herbal probe we are using, which shows color variation at different pH values. At low pH values, it has red color or violet, but at high pH values like 9 or 12, it has the color of green and yellow. Now, since it has different color at different pH values, maybe it can be used to diagnose infection. When there is an infection, pH will be alkaline and the dressing will color change to green or yellow. So that is what we are thinking, and we are trying to make such kind of dressings. Of course, these dressings we have added antimicrobial component to kill the microbes also. So it has a dual role. It kill the microbes. At the same time, if there will be an infection, it will tell us that yes, the infection has started on the wound. So we have already tested the antimicrobial properties of these dressings, and it shows very good antimicrobial properties. I'm not going in detail. And see, this is the wound dressing after dipping in the wound exudate at different pH values. You see that dressings, they have red or violet color at low pH, and at high pH it has green or yellow color. So that is why we are basically proposing that this kind of strategy we can use to design the dressing with the dual role. So this is the recent work we have started in our work, in our lab. Okay, so this is just the glimpse. I just want to show that we are regularly using contact lenses. I think majority of the, particularly the young generation, they for rectifying their vision, they for correcting their vision, they use they use contact lenses. And if they don't take care of the hygiene of the lenses or the solution they are using to clean it, then there are high chances that the eyes got infected or caught by the microorganisms. So taking this in mind, I have wrote one project in Singapore Eye Research Center only, to protect these contact lenses from microorganisms. So it is like antimicrobial coatings on the contact lenses. And you can see here, the first one is uncoated lens, and the other three are coated, polydopamine coated lenses with antimicrobial polymers. And we checked here the antimicrobial properties. You can see here, uncoated lens, they are not effective, but you see the bacterial burden in the graph. If we have the antimicrobial coated lenses, the bacteria, they are completely 100% killed. So that means even somewhere, if you catch the microorganism on the contact lens, the coating will kill the bacteria. So your eye will be safe. and this is the durability. For 14 days, this contact lens has the capability to kill the bacteria. So this is the work we have done. This is on for the antimicrobial coatings on the catheters. I think this also is very common, that the urinary catheters, they are very prone to, bacterial adhesion. I think most of the patients which are basically on catheterization, around 70% cases, they if it is long, a long duration catheterization, they got infected, they got infection because of the infected catheters. So we have done some coatings on the catheters also, and you can see here, this is without coating. You can see the adhesion of the bacteria inside and outside. These circular structures, these are basically bacteria. But when there is a coating, there's no bacteria adhesion on the catheters. So even for dental implants, you can see, if it is uncoated dental implant, there's a lot of adhesion of bacteria on the dental implants. But when there's a coating, there's no adhesion on the bacterial adhesion on the dental implants. So we are working on different aspects. So this is just to give an idea that how important these coatings are. And this is just a glimpse of our achievements, I think. And this is a very important slide. So for this particular work, I want to acknowledge my CSR AMPRI team, our director, Dr. Avnish Kumar Srivastava, our department head, Dr. DP Mandal, and all other my colleagues from CSR AMPRI. Then my collaborators from AIMS, Bhopal, NUS, National University of Singapore, Singapore Eye Research Institute, JNU, NTU, then NIMHANS, Bangalore, CSI, NBRI, IITR. I want to thank everybody, because at each and every step we need help from others also. So they are always very welcoming and helping. And my lab members, my PhD students and research staff who are working dedicatedly towards this work. And then I also want to thank CSIR for funding, and DST for giving, first of all, the startup grant, and now I recently received power grant from SCRB. So I really want to thank, and thank you very much for very patient listening. Um, so now I